According to organizations like the NIH, prostate cancer is the most common cancer and second leading cause of death among men in the United States. The rate of prostate cancer is about 114.7 cases per 100,000 males, with about 18.7 deaths per 100,000. Despite how common it is, many individuals are uneducated on the disease and are not aware of treatment options, their own level of risk, and how prostate cancer may impact them. These gaps in knowledge increase when looking only at minority populations, specifically among Black men. When a survey was administered among a population of primarily Black men asking about prostate cancer, the mean percentage of correct answers was only 28.5%, and 47% of the respondents answered "I don't know" to the questions. These shocking results reveal a lack of priority that has been placed on the proper education of the public on topics areas that are closely related to their own health. In this discussion, I will go over the importance of early detection and screening, when screening for prostate cancer should begin, common misconceptions, and the importance of looking at family history and some options for community-wide initiatives. Screening for early detection of prostate cancer is the best way to prevent suffering from its detrimental impacts. Prostate cancer can be found in localized, regional, or distant levels regarding how much it has spread. With proper screening, 70% of cases have been diagnosed at the localized stage, giving the best chance of survival. As the cancer moves to the next stages, chances of an individual's survival start to go down dramatically. When looking at survival rates by stage over a period of 5 years, 100% survived when it was discovered localized, 99.8% at regional, but only 36.2% at distant. This dramatic change in survival rate helps to demonstrate the potential consequences of waiting to screen for prostate cancer. Two of the most common screening methods for prostate cancer include a PSA test and a digital rectal exam. The PSA test is a simple blood test that looks for elevated levels of PSA in the blood, a protein produced by the prostate. Elevated levels tend to be considered those above 4 nanograms per milliliter and may indicate the formation of prostate cancer. The digital rectal exam consists of a medical provider inserting their finger directly into the rectum to feel the prostate gland and check for abnormalities. The process is generally quick and painless. For more information on these tests, check out the Men's Health Network for helpful resources and other useful links. Generally, it is recommended that men start to screen for prostate cancer at around age 50. However, men at higher risk may wish to start screening earlier, typically around age 45. Risk factors for prostate cancer can appear in many forms, some which men seldom think about. Some risk factors to consider include things such as race. African Americans tend to have a higher risk for developing and dying of the disease compared to other racial groups. Family history. Those with a family history of prostate cancer are at additional risk. Genetics, obesity, smoking, and hormonal factors, among others. Family history is one of the most important risk factors to consider. Discussions between grandfathers, fathers, and sons about the history of prostate cancer in their family can help to inform the individual and allow them to get ahead of potential issues by starting their screening early. It is also important to alert healthcare providers if there has been a history of prostate cancer in the family as early as possible, as they may begin routine tests to try and detect it right as it begins to develop. Checking family history is one of the most important things someone can do when thinking about when they should start to screen for prostate cancer, and while some may be reluctant to discuss the topic, it is important to begin this narrative among all family members. There are many misconceptions out there that hinder individuals from receiving the proper care that they require, so it's important to dispel these false notions. One of the most common misconceptions is that prostate cancer only occurs in older men. While many older individuals tend to develop the cancer, this is far from the truth, as prostate cancer can occur at all ages. It just tends to be asymptomatic in early stages, so many individuals do not know that they even have it. A young and healthy man is still at risk for prostate cancer and should follow all recommended procedures, even if they are feeling completely healthy. This flows into the next misconception. If there are no symptoms, then the person does not have prostate cancer. Prostate cancer is one of the most asymptomatic cancers in oncology, so many men will not experience any signs that they have it, or the signs are so small that they are attributed to something else. First signs are often detected during a doctor's visit, so it's important to be aware of the ability to develop this disease without feeling it. Another misconception is that prostate cancer is slow growing. There are 29 different types of prostate cancer, all with varying levels of aggressiveness. While some may be slow growing, others spread rapidly. Each case is different, so it's important to communicate with a healthcare professional and see what plan may be the best course of action. To properly tackle the issue of prostate cancer, there must be freedom to discuss these topics without the harms of stigma that are attached to them. The three greatest threats that most individuals face in their battles against prostate cancer are misinformation, lack of education, and stigma. All three are preventable issues that can be corrected with proper program implementation. Organizations such as Zero Prostate Cancer and Prostate Cancer Foundation are leading large-scale efforts to try and build an educated community around the issues of prostate cancer. However, not all operations need to be on such a grand scale. Local community events such as workshops, fundraisers, information panels, or even stands passing out information booklets at sporting events are great ways to help spread awareness for prostate cancer. Finding ways to communicate with community and showing them that it is okay to discuss such topics with others and ask for advice are crucial to leading healthy, cancer-free lives. Studies have shown that more people are willing to listen and learn about health topics when delivered in spaces they feel comfortable being at. Identifying these locations and placing educational resources within them may be the most effective method of getting the information across. Consider visiting Men's Health Network for more educational resources on prostate cancer, its risks, and different test options that are available, or purchase some Men's Health Network merchandise to continue supporting such initiatives.